Hello and welcome to Path Made Easy. Today's video is a quick summary of what normal nerves and blood vessels should look like histologically. So without any further ado, this here is a small artery. I know it's an artery because it's got a lumen filled with red blood cells, and these little black dots around the edge of that lumen are the endothelial cells. Specifically why it's an artery is because it's got a relatively thick wall in comparison to the size of the lumen. The other thing that gives it away is it's got this wavy pink line, which is the internal elastic lamina. There will also be an external elastic lamina, perhaps with the eye of faith see a little bit of that around the edge, but those laminae are not what you see in a vein. So if we look here, this is probably an arteriole, a little bit smaller, but you can still see it's got a relatively thick muscular wall compared to the lumen, and if we look really carefully, we can still see that slight wiggly line, which is the internal elastic lamina. If you compare those two with this one here, we have a really large lumen. Again, it's got blood cells in it, but the wall is relatively thin, so this is a vein. Okay, so thick muscular wall, small lumen. This one a really giant lumen and a thin wall, so that one's a vein. Just for comparison, I'll take you up here. This one here is devoid of any muscular wall at all, really. It's just got a very thin endothelial lining, so that's probably a venule, smaller again compared to a vein. All right, moving on to nerve fibers. Nerve fibers are going to look pink, and they're usually round or oval in shape. So here's one, often in association with blood vessels in neurovascular bundles. So that's always a good place to look. So if we look at this in more detail, we can see these kind of vague wiggly lines running through the nerve fiber. So there'll be the axons. This is a nerve that's been cut longitudinally along its length. That's why you can see the axons coursing through it. If we look in more detail, some of these nuclei that look a bit wavy might be Schwann cells accompanying those nerve fibers, those nerve axons rather. So there's one there, and then if I take you over here, again you can see some blood vessels, but you can see one and two nerve fibers. This nerve fiber has been cut in cross section, so you're looking down the length of it, and actually this is quite nice for seeing the individual axons coursing through the structure. Okay, so nerve fibers round or oval in shape, close to blood vessels, and you're looking for these axons with like a white space around them. So just for completeness, there's another little venule there, big lumen, very little muscular wall. Maybe a small arteriole there because it's got a muscular wall, and we've got a nerve fiber here with the little axons in it. Okay, that's it. And if you enjoyed listening to this video, please don't forget to like and subscribe to our channel Path Made Easy, and thank you to Pathogenesis for hosting the histology images.